Hey guys, welcome back to Medical Coding with Blue. It is Answer Monday. Did you guys have fun with this one? Because I had fun writing it. And then I was like, I totally cannot wait for today when I get to break down and explain what my thought process was and how I got my answers. All right. So, disclaimer always, these exercises are not official. This is just me as a veteran medical coder sharing the things that I know. These are completely made up scenarios. These are completely fictional, and this is supposed to give you good practice using your book, or if you're using the encoder, that's fine, because sometimes people like to use the encoder to practice, so that's totally fine, whatever. If you have a 2017, 2018, or 2019 CPT book, you should be good to go on these. If you have a 2018 or 2019 ICD-10 book, you should be good to go. If you have any other years other than those that I said for those versions of the book, you may come up with a different answer than me. So take that into consideration if we have different answers. All right. So I will be leaving the answers down in the description box below, along with my email address. So if you have any questions, let me know. All right. Ready? All right, so number 1, the patient had labs done during his annual exam. The patient had no symptoms during the visit, but the labs revealed microscopic hematuria. A consult was placed to urology for this microscopic hematuria with no symptoms. What is the diagnosis? And I got R31.21. So, remember that words may not always be used specifically. Just because it says no symptoms, this means asymptomatic. Hence, the more specific choice of asymptomatic microscopic hematuria should be selected versus microscopic hematuria. This is when looking at the documentation, looking at everything that the provider wrote, it comes into play. Okay? Because if you're just looking at it and you saw microscopic hematuria, there's 2 separate entries. Okay? Asymptomatic and just microscopic hematuria. So, that's why I threw that in there. So, moving on, number 2. The patient presents to the ER with stinging, burning sensation in the left eye due to being pepper sprayed by the police. What are the diagnosis codes? I got T65.891A. Toxic effect of other specified substances, accidental, unintentional initial encounter for toxic effect of pepper spray. And Y35.893A, legal intervention involving other specified means, suspect injured, initial encounter. When the intent is not specified, it is defaulted to accidental or unintentional, because they're not basically spraying the pepper spray, to harm them. They're doing it to disable them or to make them stop, but they're not doing it with the intent of harm. Okay, so number 3, the patient was in an MVA or motor vehicle accident. The patient was the driver of a car who was hit head-on by a pickup truck. Upon impact, the airbag jammed his shoulder back. He was taken to an x-ray, no broken bones, but a shoulder strapping was applied and anti-inflammatories were prescribed for comfort. What are the diagnosis and procedure codes? I got S49.91XA, unspecified injury of the right shoulder and upper arm, initial. V43.53XA, car driver injured in a collision with a pickup truck in a traffic accident, initial. And I got W22.11XA, striking against or struck by driver's side airbag, initial. So, because the airbag pushed his shoulder back, that's why I got that other code as well. Remember, when it comes to external cause codes, if there's 2, you can go ahead and use both of them because it describes more of what happened. Okay, and then I got 29240 with the RT for the strapping of the shoulder. Okay, Number 4, the patient has a history of prostate cancer. He had a prostatectomy 4 years ago. He is there for surveillance follow-up. I got Z08, which is follow-up examination after completed treatment for malignant neoplasm. And then I got Z85.46, personal history of malignant neoplasm of the prostate. So always remember that Z code, that follow-up code. Okay, a lot of people forget that and don't think about that code, but it is important. Z08 if it is a follow-up after malignant neoplasm treatment, or if it is Z09 for basically any other thing. The number 5. Okay, the patient has prostate cancer. He is currently undergoing treatment with no issues. All labs are stable. During his visit today, he receives a shot. It is for the pneumococcal Prevnar 13 vaccine. This shot was given intramuscular. I got C, like in cat, 61 for the prostate cancer, Z23 for encounter for immunization, and I got 90471 immunization, administration, 1 vaccine, and then 90670 pneumococcal conjugate, I said that right, vaccine, 13 valent for intramuscular use. Always, when you are coding for immunizations, you're going to look for that first code, okay? So there's always going to be like 2 codes when you're doing immunizations, all right? So be sure to look at the book and look in that section so that way you can familiarize yourself, all right? Number 6, the patient has gonococcal prostatitis. A transurethral drainage of the prostatic abscess is performed. I got A 54.22 gonococcal for the gonococcal prostatitis, and then 52700 for transurethral drainage of prostatic abscess. All right. Number 7, a 53-year-old female had an excision of her urethral diverticulum because she has a urethral diverticulum. I got N 36.1 for the urethral diverticulum, and then 53230 excision of urethral diverticulum female. Okay. Number 8, a 62-year-old male is suffering from urinary stress incontinence. A sling operation is performed. I got N 39.3 for the stress incontinence, and it says male or female. Okay. 53440 for the sling operation for correction of male urinary incontinence. Okay. Number 9, the patient has Peyronie disease. I hope I said that right. Excision of penile plaque was performed with a graft 7 centimeters in length. I got N 48.6 for the Peyronie disease, and 54112 excision of penile plaque with graft greater than 5 centimeters in length, because it's 7 centimeters. So, number 10, and the last one. The patient has bilateral testicular pain. I've been waiting to get to this one, so I hope you guys got it, okay? A bilateral scrotal exploration is performed. I got N 50.811 for the right, and then N 50.812 for the left testicular pain, and then I got 55110 for scrotal exploration. And that's it. There is no 50 modifier. If you put the 50 modifier on there, oh, I hope you didn't, because it is only reported once, and it is a bilateral code, so there is no modifier needed. All right? I hope you all got that one. When I saw that one, I was like, I did. I want to make sure that these are challenging, okay? I don't want to make them too easy for you guys, because like I said before, I want you guys to be prepared, or if this is something that can help you in your clinic currently, that would be wonderful. So this way you can feel more confident and just be able to have exposure to this kind of stuff, because I think a lot of times when as coders, if we kind of stay in that same same sort of clinic and don't ever get out of it, it is really easy to get that tunnel vision where you don't end up doing anything else. I always say to challenge yourself as a medical coder. Always challenge yourself, because it will do you a great benefit to do that, because this way this way you can be prepared for anything. And when stuff comes at you, you're not going to feel so overwhelmed right away. There's not a lot that overwhelms me anymore, because I know how now to handle it. As far as like, if I'm going to start in a new clinic, I'm going to do all the research I can on that particular clinic and talk to the providers and talk to the nurses about the procedures that they perform, so that way I can get familiar and then make sure that those procedures and their documentation marries up. That's the thing right there. When you're having this good conversation with your providers and you're being social, I'm just saying, this is a good thing because it opens up that communication. I always talk about this all the time. Communication. Because me personally, I tell my providers this all the time. I failed at mind reading. I cannot read minds. So I have to have you tell me if there's something that's going to make this easier for you, or if there's something that you are not quite clear on, please let me know. Because I don't know. If a provider is struggling and needs help, I can kind of push them to ask, hey, you got any questions or whatever. But it's not until sometimes I'm actually having to dig into their stuff that I can sort of pinpoint a question that they may have that they don't want to particularly ask. So this is when I have to go and ask them, okay, are you clear on this? Is this working for you if I explain it this way? So it is very important. And I say this all the time. So even if you're new and you're a student, this is what you got to look forward to, because not everybody likes to talk to their providers. It can get intimidating. I will say that. It depends on the provider too. Not all of them are so scary. Some providers are just intimidating just with their demeanor. And I think they don't mean it. It's just that's just how they carry themselves. And so it's not until you get to know them a little bit that it makes it a little bit easier. So yeah, so if you guys have any questions about today's answers, let me know. I will be including my email address, like I said, down in the description box. There's still time to submit questions for Q&A Tuesday, so let me know. All right, so I'm going to go ahead and wrap this up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye.